Not every itch is a yeast infection. It's not with every itch, irritation, inflammation, swelling down there that you run to get over-the-counter yeast infection treatment. Not every infection is a yeast infection. How would you tell that you have a yeast infection? The discharge is going to be cutty, it's going to be white, it's going to be thick, you're going to have the itching, the vulvar irritation, and the swelling and the inflammation is easily self-diagnosed. But do not get in the habit of assuming that every itch is a yeast infection, because you can sit and harbor another kind of vaginitis that could end up causing infertility down the line and bigger complications, PID and the like. Always be sure. If you are not sure, check in with your primary care provider before you rush to treat a bacterial infection with a yeast medication. Do not self-treat, do not self-diagnose unless you're sure, like, hey, the last time I had this symptoms, it was a yeast infection. My doctor told me to get over the counter whatever you got, right? Common causes of yeast infections are pregnancy. When you're pregnant, you tend to have those. When you take antibiotics without taking probiotics, you tend to have those. When you're immunocompromised, you get yeast infections. When you're diabetic and you're peeing out lots of glucose in your urine, you get yeast infections. So it's very commonly occurring, right? It's one of the most common vaginitis that women experience. How would you prevent yeast infection without taking, say, medications? Do not wear tight clothing. All the tight shapewear, tight jeans, tight whatever you're putting down there, they discourage the use of tampons, especially long-term use. Change your panty liners often. If you're putting on pads, make sure you change them up. Do not sit in wet underwear, undergarment for long periods of time, because it's just a good breeding ground for yeast. Naturally occurring bacilli, lactobacilli are living down there. It's there. The problem is when they become overproduced, right? When we feed them the sugars that they need, when we douche, when we do all the things that we're not supposed to do, sitting in hot tubs, communal hot tubs, all the things that are good breeding ground for the bad bacteria. Avoid those. Yeast infections, again, are commonly occurring. You can self-diagnose and self-treat, provided that your provider told you at one point with those symptoms that was a yeast infection, and then you can confidently treat it. If you take over-the-counter medications and it doesn't go away when it's supposed to go away, please check in with your primary care provider, because untreated infections can lead to infertility and sterility. Health is wealth, y'all. Take care of yourselves.